Hello and welcome. My name is Kathleen Young, and I am going to give a 10-minute presentation on a clinical breast examination training program that was conducted in 2018. A little background, I was co-principal investigator, and a little background about myself. I have over 35 years of work experience in academia and 19 years in higher education at my current place of employment, Cal State University Northridge, in the Department of Health Science, and my specialty area is within the Masters of Public Health and Public Health Education programs. We're located in the greater Los Angeles area. My research includes women's health, specifically in primary prevention strategies in healthcare services, specifically breast cancer screening, comprehensive services, cultural competency for healthcare practitioners, and health policy assessment. My publications, professional presentation, invited lectures, both local and internationally, and grants are in support of each of these different areas of my research lines. I completed a second master's degree with a concentration in health policy and management in 2010, and in 2012 I was awarded a tiered mentor scholar program at the domestic level, and then internationally I was awarded a Fulbright program, and I taught and did research in the spring of 2015 in Hangzhou, China. So just a brief overview. The clinical breast self-exam, CBE and BSE, breast self-exam certification program provided by the National Consortium of Breast Centers in the United States certification faculty, provided the participants training to improve their skills in their performance of CBE and BSE. The paramount objective of the clinical breast exam was detection of any palpable breast mass as another early detection tool to ultimately reduce breast cancer deaths. Participants were provided with information and education that they could share with their patients. The ability to train physicians, clinicians, and allied healthcare workers in the standardized examination technique, teaching methods, and integration into practice suggests assistance in early detection and eventual preventative behaviors. This clinical CBE training included an evidence-based curriculum regarding early detection, lifestyle changes, integration to practice, and proper examination. Okay, so I put together a co-collaborative, predominantly in the United States in the Los Angeles area. So the USA team was predominantly Los Angeles, Southern California, United States area, with one colleague coming out of Texas. And then we had the Botswana team, which I'll talk about a little bit later. So the USA team consisted of 3 trained experts. And so they taught a clinical breast self-exam training program in May of 2018, and they trained approximately 100 physicians, healthcare professionals, MDs and RNs, as well as MD and nursing students and other allied health professionals. The training program provided 1 through 5 guidelines and statistics of breast cancer and breast cancer screening, as well as other aspects of comprehensive care and treatment, critical thinking and pathways in overall breast health and breast cancer comprehensive care, most current scientific clinical breast exam techniques utilized in the U.S., and best practice in prevention education and comprehensive screening utilized in the United States. And each individual was provided with a certificate of participation in the training. So here is a picture of the team, except for Jenny Keene, who was also part of the team with a background in engineering from the FAA, which is the largest federal aviation association in the United States. So this was the team from the United States, and again, was predominantly from the greater Los Angeles area. The members of the Botswana team, we worked at Bokamoso, which is the largest private hospital in Gaborone, and Gaborone is the capital of Botswana. So we had the chief medical officer and then 3 different heads from cancer, infectious disease, endocrinology, and women's health. Uh, Also present and very vital to our program was the Honorable Justice of Gaborone, and then the CEO of Health First Foundation of Gaborone in Botswana. And so Dr. Moleli is the chief medical officer and endocrinologist. And again, we just cannot say enough about the tremendous support and help and professionalism. It just changed my life. I adore these people. Uh, uh, So the results, there were actually over 100 physicians, 104, but I wanted to be careful as far as my numbers, but it was actually technically 104. But 100 physicians, healthcare professionals, as I shared, MDs, RNs, and then medical and nursing students and allied health professionals located predominantly in Gaborone, the capital, but also throughout regions of the country where trained in the most current scientific CBE techniques utilized in the United States at that time. And we would like to acknowledge that the United States National Consortium of Breast Centers provided approval for this team to bring this program to Gaborone in 2018, and we thank them for their support and their services and allowing us to use their curriculum at that time. I also was fortunate with our 2 colleagues from the United States to do 2 presentations at IWG, the 7th the 7th World Conference. And then we had the great fortune to work with um, the Journey of Hope, which is the largest breast health NGO in Gaborone, to discuss best practices in breast cancer screening and breast health practice between Botswana and California during our stay at the. And here is a picture of part of the team as well as presenting with us. I'd like to dedicate this is Dr. Bridget Malone, and this is Bev Denbury, who was the founder of the Journey of Hope. And I'd like to dedicate this presentation along with for Mr. Steve Belfield from Los Angeles, and all those that we've lost to breast cancer and those battling the disease. Bev passed away approximately 2-3 years ago, and I would like to dedicate this to her and her extraordinary spirit and work, as well as Dr. Malone and the entire Journey of Hope, as well as Botswana or Bokamosa Hospital, their faculty, staff, and professionals. And this is some of the work. The NGO there was just, we were fortunate to be able to go to one of their events and to talk with them about their work as well as what the hospital in Gaborone is. This is a very short presentation, and and so if you have any other questions or would like information, we're more than happy to provide that to you. Here's my contact information. And again, I want to thank the professionals, the contacts, the entire hospital, Bokamosa Private Hospital, as well as the Journey of Hope, and then the colleagues here in Los Angeles, and Carol Oglesby, who is a colleague of mine here. If it hadn't been for her, this never would have taken off. So thank you very much.